Welcome to the Death Happens podcast, an insider's guide to dying. We're your insiders. I'm hospice nurse Penny.
And I'm Halley, hospice social worker. Today, it's just Penny and I, and we're doing an education. We're going to be talking about everybody's favorite topic, deathbed phenomenon. Penny,
Yes.
Take it away.
Deathbed phenomenon. So there are three things that I can, you could say there's four things that I consider that are kind of what I would consider to be phenomenon when a person is dying. One is the obvious, which is the deathbed visions, where people are actually visioning their deceased loved ones and pets. The end of life rally, where somebody who is apparently down for the count, looks close to the end of life, has a burst of energy, wants to eat, wants to visit. The speaking in metaphors, where they're kind of talking about wanting to go somewhere, wanting to go home, needing to pack, needing to be on a trip shortly before their death. And the apparent control that some people have over the actual end of their life when they are waiting for someone to leave or waiting for somebody to arrive.
Mm-hmm.
So which one should we tackle first?
Well, if you want to keep people engaged in the conversation, you know they're going to want to hear about the visioning. So maybe we save that for last.
Great idea. Great idea. Let's talk about the end of life rally first, because that's another one that's interesting to people. And a lot of people ask, why does this happen?
Mm-hmm.
And first of all, I want to say that when it does happen, we really have to manage expectations, because I don't know about you, Halley, but I've had this happen where my patients' family members thought, oh, they're getting better. They can come off of hospice now. And in reality, it doesn't last very long. I always say it lasts about a day or less, and then they usually die within about a week. I don't think that's a hard and fast rule, but...
Yeah, I think that the trouble always is with rallying as well as with terminal agitation, which we can talk about a little bit. What I found, and I have had this happen lately quite a few times, is it's so much easier to look back and say that's what it was than to say what it is in the moment.
Ding, ding,
And
ding,
people
ding, ding.
want that answer, and we just don't have it.
That is so true. And I have seen people have a rally so many times. I'm sure you have too. And we do, like, even as hospice, like, experts, second guess ourselves and wonder, is this what's really going on? And it really is, like, hindsight is 2020. Looking back on it, we're like, oh, yeah, that was a rally, you know, like we think that's what it might be. And so I would often frame it around, like, this is a window of opportunity. It may not last, you know, we may not continue to see this improvement, because sometimes people do apparently improve and then actually they die shortly after this happens. And you're right, terminal agitation is kind of the same way, you know, that we can kind of arrive at that conclusion without having to look back on it. But usually by the time we are arriving at that conclusion, we're sedating them.
Right.
You know, it takes so long for us to figure out, oh, this is terminal agitation. It's not pain, not poop, not pee. It's existential or whatever.
And I've had a lot of different terminal agitation types. I think people have, just like any of these phenomena, people have one idea of what it looks like. So the rally, people, I think, have an idea of people are completely unconscious and then they just wake up and want a cheeseburger, right? And it can look a lot of different ways. The terminal agitation I've been seeing lately, and I'd love to get your feedback on this, and particularly it is people in their kind of 50s to 70s. That is my range that I've seen the most active terminal agitation. And not terminal agitation at the very last day to an hour, but like a couple weeks out. And it lasts in this way that they're up and they're pacing and they're agitated. And you don't know for sure that it's that terminal agitation part, really. And you're just trying to like throw medication at it or throw different interventions at it to see what will help and not go to sedation before you really need to. And man, that's so hard on the families.
Yeah, it really is. For me, what I've what I've seen the most when it's terminal agitation is it's closer to the end of life, and this just constant trying to get up, and they're not able to be redirected, and they can't communicate to you what they're feeling or what's going on in their mind. They're just not. And I've seen it a lot in younger patients, especially younger patients. And I had one patient. This to me is the thing that really blew my mind about terminal agitation. And it was really towards the end of my part of hospice nursing where I was doing patient care. And I had experienced terminal agitation on so many times with so many patients because I worked in, as you know, hospice care centers for like 7 years. So we did a lot of palliative sedation for terminal agitation, or even assessing, just sometimes they weren't terminally agitated. They just were constipated or, had pain. But so it's really experienced with terminal agitation and the treatment for it. And I got a patient who was in the hospital, and she was 32 years old. And she had pancreatic cancer. And when I met her, she was just so confused and agitated. She was in the hospital bed, but couldn't get up, and it wasn't trying, but she also had anasarca and ascites. So she was like from the here down, hugely swollen, huge.
In the
And she was
abdomen for those on the audio feed.
Yeah, ascites in the abdomen. Ascites in the abdomen, which is fluid buildup in the abdomen from pancreatic cancer, liver failure, swelling in her legs, just huge. So she couldn't even try to get up, but she was just whipping herself back and forth in the bed, completely incomprehensible. Couldn't have a conversation with her. So I went and talked with the nurse, and I said, I think she needs some Haldol. And she said, well, they gave her some in the emergency room. And I said, I think she needs some more, and talked with her about what did she have ordered PRN, and said, let's give it to her, like every time she can have it, let's give it to her. And the next day
we got to take a time out because you're throwing around a bunch of medical terms that I know. So haloperidol or Haldol
is an antipsychotic medication that we use in hospice. It's part of most hospice agencies' comfort kits because it's effective for agitation, hallucination, nausea. It's my favorite drug for nausea. I absolutely love it for nausea. So it works really well when people are agitated or delirious.
And then you said PRN. So for folks that don't know what PRN is.
Bad. As needed. As needed. Yeah. So she had it scheduled like every 4 hours as needed, and she needed it. So I went in the next day, and she was sitting up in the bed, clear as could be, and looked beautiful. Stuck her hand out to me to shake my hand, introduced herself, and I said, I met you yesterday, but I don't think you remember. She goes, yeah, I was pretty out of it. She goes, when I went in to see the oncologist and he told me I had 3 months left to live, I think I had a nervous breakdown. She said, I'm a hospice social worker. I knew what that meant.
Wow.
So for those of you who don't know what that means, doctors are terrible at prognostication, and Stanford did a study and found that many doctors will prognosticate incorrectly by 3 months to the good. So if they tell you you have 3 months left to live, you don't have 3 months left to live.
Oof.
So that was the first time I ever had a patient who could actually tell me why she had such agitation. It was crazy. I was just blown away by that. And she died a few weeks later.
Yeah. And as you were telling the story, I was thinking about the fact that deathbed phenomena do not happen 100% of the time. So, excuse me, I'm thinking families will sometimes be hesitant to use more sedating medication because they want to have that last chance at communication. And it doesn't always happen. So you don't want to have them suffering for this hope of something that's less likely than more likely to happen. Right. And that's a hard conversation to have, right? Because you don't want to as we've talked about before, we're not giving up hope of things. We're setting up expectations and different hopes. But if one of the hopes is that your patient or your loved one is going to have this rally, that's not the best way to go about deciding whether you're going to medicate for a symptom.
So I'm glad we're circling back to the rally, because there is a theory about what causes it that I want to talk about. But so one of the things about the rally is, and I do educate about it all the time on my social media, but as a nurse taking care of patients, it's not something I ever brought up to the families unless I thought it was happening. Mm-hmm. Because speaking of setting expectations, that is something that people will be disappointed about happening if it doesn't. Mm-hmm. And I've had people in my comment section who have said, I was really hoping for a rally and it didn't happen. So it wasn't one of those things I ever brought up ahead of time. It's just if I started seeing it happening, be like, I wonder if this is what we have going on here. But the theory that I've seen that really makes sense to me, and I hate explaining away things, because I mean, some things, yes, it's good to explain them away because we can do something about it, especially terminal agitation, right? It's something that's really negative that we want to treat. But when it comes to kind of these unknown, mystical kind of fun things that happen to people at the end of their life, I don't really necessarily feel like we have to explain those away. I feel like we could just enjoy them for what they are, especially deathbed visions. Mm-hmm. But with the rally, what I've heard is that some scientists and medical professionals, I guess, are saying that they feel like it's probably an excretion of hormones by organs that are shutting down.
That makes
sense. That makes sense because when we give steroids to people, and steroids are hormones, it perks them up. It's another drug we love to use in hospice. It makes them more awake. It makes them less fatigued. It makes them hungry. And so it makes sense that is what is happening to somebody when they're having an end-of-life rally, is that their organs are failing and they are excreting hormones, steroids, that are giving them a little last hurrah, perk up.
That makes sense. All right, let's talk about travel language.
Yeah.
Because this one probably is one of my favorites that I see the most often. And it is something that it's more of that tangible thing like you're talking about. Like it's an educational piece that gives families peace of mind, because here their loved one is trying to be at their, home, where their home is. And loved ones and caregivers are just so frustrated because they're like, I'm telling them they're here. I'm telling them that, we're here. And I'm like, no. And as soon as we give them the explanation of, this is travel language, this is common, and here's where we usually see it, and here's what that could mean, the relief on them is just palpable.
Yeah. I've never considered it travel language or heard it referred to as that. I really love it. I always say it's speaking in metaphors. And I just crack up when you said that about they're arguing. So I actually mentioned that even in my book, and I talk about it all the time. Like when I do any speaking engagement and I'm talking about speaking in metaphors, I always say, there's so many times when I've gone to see my patient and the spouse says, we argued all night because he kept saying, I need to go home. And I kept telling him, you're in the house we've lived in for 20 years. It's so common. Or people who are in the hospital and the family feels bad because she kept saying, I need to get out of here. And we wanted to take her home, but we couldn't. And then she died. It was like, yeah, she was needing to get out of here, but not here, the hospital. Here, wherever the, I always say home means something else to somebody who is dying.
And we don't, do we know? We don't know. It could be that they're thinking about their childhood home. Maybe they're thinking about heaven or whatever that looks like for them. I mean, we don't really have a way of knowing. They often can't really articulate it to us, but it's, similar advice to someone with dementia. You're arguing is not going to help the situation. In fact, you're only making it worse for both of you.
And I also think that the travel language / speaking in metaphors goes hand in hand with the idea that people can kind of control when they die.
Perfect
and
segue.
I want to say, I love Barbara Carnes saying, that we live in our bodies, we know when we're dying.
Mm.
And I think that's very true. And I think that's what the travel language is all about. And so many people, and I don't know about you, Halley, but I have seen more people who waited for family to leave
Yep.
than those who waited for them to arrive.
100%.
That's what I have seen more. And maybe that's because there are fewer people who have family that can't get there or is delayed in getting there. I don't know. But it does seem like to me more people wait for the room to be empty before they take their last breath. And I think too, it's often people who are maybe not as social, more introverted, I think that has something to do with it too. It's that kind of goes in line with the we die how we live, I think.
Well, it reminds me of your conversations previously where we talked about Lisa Paul and not petting our hands, right? If that's at the end of life, don't pet my hand. You're actually going to cause me to stay here longer if you do that, because I'm going to be irritated and I'm not going to be able to let go.
Exactly. Yeah. Doing things to people that make them be uncomfortable can keep them here. I've seen that so many times. I often tell the story of my patient who was dying in the care center and the daughter was on the bed crying and the family was telling her, you gotta tell her it's okay. And she was crying saying, it's okay. And clearly not okay, and they call me in to pronounce her, and my stethoscope's on her chest for 2 minutes. I'm about to say she died, and then she takes a gasping breath and she lives for another couple of hours until that daughter can finally be calm and let her go. So yeah, I think we can keep people here. Hand petting especially. Like, don't pet my fucking hand. I'm not your pet. I'm not an animal.
Well, and speaking of keeping people here and choosing timing, I've also had where a loved one will be basically, NPO, no food intake, no fluid intake, and no real consciousness or very minimal consciousness for 2 or 3 weeks. And that's not voluntarily stopping eating and drinking. This is at normal end of life where that stuff's already been happening. And the family is just struggling with why are they lingering? And then, of course, equating lingering to suffering, which we don't ascribe to. And sometimes I will just say to the family, like, I don't know. Maybe they are having an extended life review in there. But maybe they're giving you an opportunity to be as ready as you can be. We don't really know, but why not ascribe it to something that's maybe a little more helpful in these hours that you're dealing with it? Because we don't know. It's going to take, as you say, it's going to take as long as it's going to take.
Death takes as long as it takes, and sometimes it takes a while. Yeah, and lingering does not equal suffering for the person who's dying, as long as their symptoms are well managed
and they're kept clean and all of that.
Yes, and I think really it's more the family suffering that causes that notion that their person is suffering because they're dying so slowly, and really it's hard for the family because they get into this is where we go into anticipatory grief, right? Like they're waiting for this awful thing to happen, and then you start to kind of wish it was over, and then you're wishing that your person would die faster, and that's a horrible feeling.
And then you feel guilty, and then you feel shame, and here we go down the cycle.
Exactly. So true. So let's see.
And the caregiver is hyper vigilant, and so they're exhausted, and that's just not helping anything.
Right. And that's when we say, you should step out. Right. And I think I've probably told you this story before, Halley, and I've told it on social media, but for those who haven't heard it, when I was working in the care center, we had a man who was dying there, and his nephew was with him. And his nephew was, I think he was probably in his late 30s, early 40s, kind of a little slow on the uptake, like little. He was just a little off, but his uncle had raised him, and he said his uncle was like his father to him, and he was not going to let his uncle die without him being at his side. And his uncle was lingering forever, like he was just actively dying for a week. And finally, we said to his nephew, who had not left the room, like, maybe you should go get something to eat. And he said, I don't want to leave. And we said, he's fine. He's fine. He's not going anywhere. Just go. There's a great place down the street. Go get a bite to eat. We'll keep an eye on him. We'll call you if anything happens. Sure enough, the nephew leaves and his uncle dies shortly before the nephew's return. And so I ran down and said, come on. He's right. He's on his last breaths right now. And my partner went in, was with him, and we brought him in, and we're like, oh, here he's on his last breaths, and we let him think that he had been with his uncle when he took his last breath. I would say that's lying for compassion.
And I remind me of Andrew White's story of that similar thing. Like, does it really matter in minutes? You're not lying for compassion. Yeah. I'm all for it.
Yeah. Although I got some hate on the video from, trolls who are like, what if he watches your video and he knows now that you lied to him? And I'm like, he's not going to watch my video. And if he does, he won't even know it's him, know? And if he does, will he care? This is 20 years after the fact, I'm not worried about it. I'm sure he'll understand why we did what we did, but it would have been he would have grieved so much harder had we not pretended like, he was with him at the end of his life. So, okay, so we talked about
before we get to the end, Penny, I want to make sure people know about your book, because this will come out probably after it's released. We're doing the pre-sales now, so tell us about your book, and then we'll get to Deathbed Visions.
Yes. Okay. Yeah. Pre-sales now. It'll be up for sale for real. I mean, like, you can buy it during pre-sales, but January 14th is the expected publication date. You can buy it on Amazon. You can get it on my website, hospicenursepenny.com, just wherever you buy books. And it's called Influencing Death, Reframing Dying for Better Living. And it's a memoir.
Awesome.
Thank you. Halley's read it. Halley was one of my early informal editors. And it's just a journey about my life, being bullied as a child, going through some really hard times with drug and alcohol addiction, ending up in jail, going to nursing school at the age of 40, and becoming a hospice nurse. And there's lots of education about death and dying, and stories, and humor, dark humor, of course, because that's how I roll.
And it really is woven together so perfectly with your story and the education on death and dying. I'm not just blowing smoke up your ass. Anybody that knows me knows I'm not just going to say something nice to be nice. It really is a great book. I hope everybody reads it. They should, but.
Thank you. And I do talk about some deathbed phenomena, some of my favorite stories about end-of-life visioning, including my experience with, my dad didn't have end-of-life visioning, but I had an after-death experience with my dad. But
yeah.
And after death. Isn't it interesting how we say afterlife?
That's a good point.
It's really after death. All right. Deathbed visions. Let's talk deathbed visions.
Let's do it.
So, first of all, let's address the fact that even though it's referred to by many as deathbed visions, you don't have to be on your deathbed to have deathbed visions. People can have visioning weeks before their death. I've had patients who were completely lucid, cognitively intact, no confusion whatsoever, not on medications, who were having visions of their deceased loved ones. Pets sometimes. I know I've had patients who have seen their pets, but it's not as frequent. The one that I remember the most is the lady with a cat looking for her cat in the hospice care center, and recruited me to help her find her cat. And we allowed pets, and I did not think anything of it other than there's supposed to be an adult in the room with the animal, not just the patient. Wonder where they went, and then looking for this cat that she then told me was actually her cat from when she was a kid. So that was kind of mind-blowing. What have you experienced, Halley, with your patients in terms of deathbed visions?
I have one particular individual was raised at an orphanage with nuns. And so they had a lot of nuns and angels. That's a pretty unusual one for me. Not common at all. Another person saw a door and their loved ones coming to the door, and there was one particular loved one that wasn't showing up. And so this was causing some distress about where's this person. But it was all loved ones. So I think just to be clear about visioning, we don't mean like you're seeing spiders on the wall or something. It's not hallucinations. It's visioning, which is a very different phenomena.
Right. It's not the same. In fact, we will medicate for hallucinations. First, we'll try to find out what's causing them. And if it's something we can eliminate, like a medication that's causing a side effect, then we will do that. But if it's...
And see if it's distressing, too. Sometimes
Exactly.
it's not.
Yeah, I mean, that's true, too. Like, we don't just throw medication at someone because they're hallucinating if it's not distressing. In fact, sometimes people will not identify who they're seeing. So this young woman that was on TikTok, Amanda, 25 years old, had breast cancer. She started actually visioning dark figures and couldn't place them, but it didn't distress her at all. She didn't feel uncomfortable with that. She also was seeing a cat, and her mom was seeing the cat too, which was very unusual.
Very cool.
I think you could kind of put that in the shared death experience category for some people have shared death experiences. But yeah, she was like, it's not one of our cats. This is not one of our cats that I've been seeing. And she said,
yeah, I mean, speaking of shared death experiences, I don't think I've talked about it on here before, but my father died when I was just before I was 10. And within the week of him dying, he was in a hospital bed in our house. We had hospice. And my mom was getting ready to go somewhere, I think to the store. And she was standing in the kitchen and she looked back and he, in his full naked form, was standing in front of her, not saying anything. Now, he was actually in the hospital bed. He had been comatose for 2 weeks.
Wow.
And then she like kind of, turned around or shook it off and like he was gone. And he died just, I want to say just a couple days later. So
I must have known, we must have talked about your dad's death before.
I think we did, but we didn't talk about that.
Right. No. But I mean, just the fact that he died when you were so young. How did he die?
He had a glioblastoma, likely from Vietnam, Agent Orange.
My husband's father also died of glio. Glios are I mean, they can happen to anybody. They're so random, and they can go slow or they can go fast.
And that's a brain tumor for folks that don't know.
Yeah, it was a brain tumor. And can really
aggressive.
change people's personalities. People can really have personality change, which is unnerving to family members when that happens. So, wow, that's an interesting experience that your mom had. But yeah, so deathbed visions, people like to say are caused by medication, which we know they're not, because like I said, people have them without being medicated. Or one common theory is the DMT, dimethyl something or other, the fuck I can't pronounce. Methyltrexose something, I don't know. I actually did look it up for my book because I talk about it in my book, but so people kept saying this to me in my videos, like, it's just DMT. And I'm like, again, this is one of those things where I don't feel like we need to explain it away. It really brings peace to the person. Let them, if it's not real, let them think that it's real, because it brings so much peace to them. And it's something that I think has helped my death anxiety, because I look forward to that. I look forward to seeing my dad, my cousin who killed herself, anybody else who dies before me. I look forward to that part of the dying process if I get to experience it. So I get really spun up when people are like, it's just DMT. And so I looked up DMT and found that it is a naturally occurring chemical that is in plants and animals. And that people, like indigenous people, used to use it for raising their spiritual awareness so that they could communicate with the dead. with their dead ancestor. So then I started to have this idea of maybe it is DMT. But if it is, then DMT and real live spirits are not mutually exclusive.
Right.
Maybe the DMT is helping you to connect with your spirits. It doesn't rule out that those are actually real spirits that people are seeing. So I'm going to ask you, Halley, what do you think people are seeing when they see their deathbed visions? Is it a figment of their own mind, or do you think there's more to it than that, and maybe they really are seeing spirits?
I definitely think people are seeing their loved ones. I have some pretty complicated agnostic feelings about religion and even the afterlife. But that being said, every experience that I've had personally, every anecdotal experience and that I've had and with my loved ones has been without prompting them describing someone that they know personally. So who would I be to say that that's not real? And speaking of your sister, just in case listeners are wondering, one of my patients did have a vision of a relative that died by suicide. So that's, I think people get concerned about, is there this hell and whatever? I don't know if there is or not. But they saw their loved one and they died by suicide. And I've not one time ever seen or heard anyone vision the devil or flames or whatever. I've had people not have deathbed visions at all. Of course, I think that's probably the majority of my patients haven't, or they haven't told me about it.
I haven't told you about it, probably.
Yeah.
Yeah. It was my cousin, for point of clarification, not my sister,
sorry.
who died by suicide. Yeah, I've never had a patient tell me that they saw anything evil, the devil, flames. I haven't ever had a patient who told me that they saw angels or Jesus that I can remember.
I've only heard that twice in all the people.
I also think that doesn't necessarily give any weight to the Christian belief. I think that's what they're thinking they're seeing. But what was I going to say?
Sorry.
No, I can't remember what I was going to say. Damn it! It had something to do with.
You weren't seeing flames. Nobody's seeing flames. Nobody's seeing the devil.
No, nobody's ever seen anything like that. Nobody's told me they saw angels or Jesus. Oh, people ask me all the time, what if you're an atheist? I've had atheist patients had deathbed visions. You don't have to be religious to have deathbed visions. I think it happens more than we get to experience. And I was talking to hospice nurse Julie about this too. We were talking about how, we have some stories about patients who were able to tell us what they saw, but not a lot. And that when people are in that space, we don't dive into it with them and ask them a lot of questions. I did ask my one patient if it was his wife that he saw, because he was yelling her name and that she was coming to get him. But other than that, we usually are just kind of observing what's happening. We're not really trying to get in there with them on it, and so it's not really probing when they're doing this. But I also think that people have them and either don't communicate that they're having them or aren't able to communicate that they're having them. Because I did have a patient who was denying it until I told her that it's normal. Because I used to ask my patients all the time, or their family, if the patients were unresponsive or unable to really communicate, has there been any talk about seeing deceased loved ones in the room? Or have you seen anything? I asked my patient, have you seen anything out of the ordinary? And she said, what do you mean? And I said, well, people that have died before you. Oh, no. But when I told her it was normal, then she said, well, my dad is standing in the kitchen, and he's dead. And so I think people are reticent to talk about it because they're afraid people are going to disbelieve them. Or like I said, they can't communicate. And that's where I think this whole reaching thing comes in, which is kind of another phenomenon that we see at the end of life when people are reaching into the air, reaching to the corner of the room, reaching up above them. That is often where these visions are seen. And so I really feel like they're reaching for those visions. Oh, and there was something else. I just remembered what I was going to say. Finally came back to me like fucking 5 minutes later. So I've had people say, what about when you see people that you don't recognize?
Mm.
And I said, I wonder if you can vision people that you are related to by blood that you have never met at the end of your life and you don't recognize them. Because one thing else that I've seen people do, and I don't know if you've seen this, I'm guessing you probably have, is when a patient keeps thinking that the person that's in the room with them is someone else.
Yep.
Like my mom kept calling me mom. I'm her daughter. Why was she calling me mom? Because there's this confusion about like who they're seeing, So, I mean, I've seen that a lot too. And so, I wonder.
No saying that it's not a long dead relative, that maybe they were a child when they met, or even before that, like if we're seeing relatives, why does it have to be the ones that we lived with?
Exactly. That's what I think. That's exactly what I think. Or I've had people say, my mom's visioning, but she's visioning someone who's still alive. She keeps saying that she's seeing her sister, but her sister's still alive. Is there somebody in the past that looks like her sister that she is visioning?
Was there a lost child that nobody heard about? Because nobody talked about that kind of thing back in the day.
I did have a patient that happened with. She was seeing a baby, and her adult daughters were like, she keeps saying she's seeing a baby, and we don't know what she's talking about. We're her only kids. And her sister came to visit and said she had a baby that died.
Yeah.
Nobody knew about it. She never told her adult kids. She never told her kids about it. So, yeah, can happen.
Yeah. And you were talking about the reaching into the sky. I've also seen people just staring at a particular place in the room. And even if they come back to talk to you, they go back to staring at that thing.
I completely believe that people are here and then they're somewhere else and then they're back and then they go back and forth. And if you're with a dying person, you can really, like you say, you can kind of see that. They're like fixated on something else and then they're back to you again and then they're somewhere else again. I just really believe they've got their, like, what is it? The veil comes down or something like that. They say the veil
or lifts up.
The veil. Oh, the veil is lifting. That's what it is. The veil is lifting. The veil is coming down. The veil is lifting. Yeah, they have their foot in the grave for sure. I think
it's so, the thing that makes me the agnostic part and not just say, forget everything, nothing's real, and we just blink out of existence. There is something indescribable when you're with a person that dies, that they're gone. And it's not the breath, it's not the last breath, it's not the heartbeat. There is something different about that physical body that has changed. And that spark of life that we can't define and can't know it's real. We've all witnessed it if we've had the honor to be present for someone that died. And yeah,
absolutely. People ask me, have I ever seen a spirit when somebody dies? And I say, no, I've never seen a spirit, but there's definitely an energy shift in the room when someone dies. And like you say, I don't even have to pronounce them. Like, I don't have to put my stethoscope on their chest. I can tell they're dead.
Yeah.
It's definitely something that changes. And I've probably said it a million times, but, learning about chemistry and nursing prerequisites, you learn that and nothing ever really goes away. Nothing ever completely disintegrates into nothingness. If anything, it transforms into energy. And that's what I think. And if you think about like the cloud, right? The internet cloud. And I know there's a physical place where this information is housed, but it's out there. Like there's this cloud where our shit is.
Yeah.
And you have to wonder, like, where does our consciousness go? I just don't think it completely disappears. And I'm the same.
500 years ago, no one could have sat down and told somebody that we would be able to see each other not in the same room and talk in the same space. They would not have been able to conceptualize that. And why is that any different than something else we can't explain?
Halley, not 500 years ago, 50 years ago.
No, I'm just giving an extreme example. 50 years ago, at least we had TVs.
As a teenager, could never have imagined that I would be able to have a cell phone. You know,
you mean a computer in your pocket?
A computer in my pocket. Yes. I grew up with a party line, you know, like we had a party line when I was a kid. You had to pick the phone up and make sure somebody else wasn't on it already. You know, it's crazy that I drove a car as a teenager, and if I ran out of gas, I was fucked because I'm not calling anybody, you know, unless I can get to a payphone, and then I've got to find a fucking dime to make a phone call. So, yeah, I think, you know, we will learn more. But again, I think I would say that I hope that it's more in the category of there is more because we don't know what there is, rather than we'll find out.
Exactly.
People will say, this one cracks me up. I get this in my comments once in a while. Are you looking forward to a time when nobody ever dies?
No.
What the fuck?
I don't want to be immortal.
Why would I look forward to a time like that when the world is already getting overpopulated? Like, I don't want to hang around. I want to leave the world to the next generation so they can enjoy it. And I'm not going to fill it up with a bunch of old people.
There's nothing biological that doesn't die. Even if you're a tortoise or a tree and you live for 100 years or hundreds of years, you're going to die at some point. There's a life cycle. Yeah. And there's nothing to be afraid of with that. And it's such a release, you know, when you've fulfilled your life cycle, whatever that looks like, whether it's 20 years or 90 years.
Yeah.
Or 200 years.
It is, you know, and even young people who die too young, and there's too many that die too young, when they get to that point when they're dying, unless they have terminal agitation, which we see, they really get to a place of acceptance for the most part. I mean, people get to a place of acceptance when they're dying. So
most of the time,
I would say I don't have religious beliefs. My spiritual beliefs are like yours, agnostic. I say agnostic bordering on Buddhism. I used to say agnostic just in case. Like, I believe in God just in case. But, you know, I have the same belief as you do. And sometimes people will accuse me of being religious when they see videos that I make talking about deathbed visioning or my experience with my dad's death, where he came to me after he died. And I'm like, no, don't call me religious. That I am not religious by any stretch. I'm just somebody who has witnessed a lot of death, and literally thousands of dying patients, and seen too many things to be able to completely discount that there's nothing after we, you know, or that there is something after we die. Like I can't say there is nothing after we die, because I don't believe it. I believe that there's something. I just don't know what it is.
Yeah.
But I think there's something.
I mean, how much better would the world be if we could all get to a place where we can be comfortable saying, I don't know?
So much better. and it's the reality.
Yeah.
It's the reality. We don't know. People who think they know don't know. They just think they know. Nobody knows. Only the people who have died know. Or in the case that there is really nothing after we die, nobody knows. Not even the people who died, because there's nothing.
Exactly.
But I don't think there's nothing. I think there's something.
Well, I do have to say I love our guests, but it's also very fun when we get to riff on stuff that is the insider part of this.
I love this, and I think we should do it more often too. I think it. I agree. I love having our spectacular guests for giving us different perspectives from other areas of healthcare or experiences with death and dying, or being dead. And, we'll continue to have guests, but I think that we're onto something here. And we got to figure out the whole live stream thing. That could be also really interesting. It's great when you can get comments and questions from people that you can address in real time. So we're going to figure that out.
Yeah. All right. Well, for now, this has been great. Again, reminder, deathbed phenomena are incredible, but they don't always happen. So don't be disappointed. It's not anything you did or anybody else did that if you don't have that experience, it just wasn't for you, or it wasn't meant to be told to you, or however you want to look at that. But
yeah.
But in the meantime, remember to live.
Because someday we'll all be dead.